Anchor. So if you're watching me on Instagram, okay, I think for me it's here now. Let's just start for me first, and then we can continue. All right. So welcome to ATP Live on Monday. So you can watch it on YouTube, you can watch it on Instagram, you can watch it on Facebook. I think it's going on. I can see one person on, I think, on Facebook also. Hi, Fumi, how are you?
Good evening, Ma.
Long time. How are you doing?
I'm fine, thank you, Ma. How's your
Okay,
day been, Ma?
fine, fine. You guys have not resumed yet, right? So you're still at home.
No, Ma. We are still enjoying, but I think tentatively we are resuming on the 21st.
21st? I thought it's 14th of
Yes.
September.
No,
Oh,
higher institution 14th,
oh,
then
okay.
secondary school 21st.
Oh, okay. I think I mixed it up. Okay, so we're welcome. So this program is for us to answer any health question you may have on any child health issues. So it's a live program. So just feel free to drop your questions in comments and I will be answering them. For me, will be reading them. I'll try and we focus more on Instagram, which is our main focus. But if you are on YouTube, on Facebook or YouTube, and you also have your question, drop it in comments. I'll see as many of them I can take as possible. So you're all lucky today. You can watch it from any from device that you have. All right. So welcome everyone. I can't see any question
Yeah,
yet.
I can see Zach Sikelua, I tutor French, born in well, the best work, CFK Bar. You're welcome, everybody. Please do invite your friends, your families, your sisters, your cousins, Emerald Air Brand. You're welcome. Thank you for joining us. Please invite your neighbors as well. You will benefit more from it, please. You invite your neighbors. We don't have enemies on ATP, so I don't need to tell you to invite your enemies. Invite your friends, invite your family. Yeah, we have a question, Ma.
Okay, so we'll start to answer the
We have a
question now.
question.
Yes, go
Okay.
ahead and
Good
read it.
evening, Good evening, doctor. Please, my son of 15 weeks has catarrh since Saturday, and he threw up last night.
Wow.
And he threw up last night and found it a bit difficult to breathe after vomiting, EBM, and trying as much as possible to reduce.
Okay, how old is this baby? 15 weeks.
15 weeks, yes, ma'am.
Okay, so yeah, it's common for babies to have acute respiratory tract infection at this time. So what you need to do right now is to keep your baby warm and give the baby. I don't know whether you're exclusively breastfeeding or not, but
Yeah, she's exclusively
okay,
breastfeeding.
good. So you can continue with your exclusive breastfeeding and keep your baby warm. And if there are other signs apart from the catarrh, the vomiting may just be, I don't know, if it just once, I will not just run with that. I'll just watch for now. But unless baby is continually vomiting and not tolerating any food, then that means you need to do something. But if it's just once, you can just watch for now. But make sure there are no other signs like fever, like cough, like fast breathing. If there are all those other signs like cough, like fever, and like fast breathing, then you may need to take the baby to the hospital. But if it's just a catarrh, no cough, no fever, no fast breathing, just watch for now. If the nose is blocked, you can use what we call saline drops. It's just like normal saline, but in a small container that you can drop into the nose to soften the mucus, and then the mucus will drop. Will flow out, and the baby can breathe far easier and will be fine. But most importantly, make sure you keep the baby warm at this time. Don't expose to her. Keep on breastfeeding exclusively. We don't recommend cough syrup. We don't recommend any catarrh medication, anything like that. So just watch. But if you are not happy, if you are not comfortable using things are getting worse, then you can take your baby to the hospital. All right.
Okay.
Thank you.
Yeah. Emerald Air Brand, my lifesaver as a first time mom. Yeah, that's a lot too. Thank you for that. Now, Emerald Air Brand again. Good day, doc. I noticed a kind of growth on my baby's vagina. It's just under the place where she excretes pee. She's a day old, and the growth was not noticed before we left the hospital.
It grows. So are you saying when you say it grows, it means something growing that you cannot remove or what? So it's very important that that's a very significant observation, and you really need to take the baby to the hospital because they need to know what is there. So I just want to be sure what you are actually referring to. And so you really need to take the baby to the hospital. But right now I'm trying to even think what could be growing in that area. I don't want to assume maybe there's something normal you assume is a growth, but I think it's better you take the baby to the hospital so that we are sure what we're dealing with. Okay, for me, let me just take a question from I think it's Facebook now. Eweka Tonia is asking, good evening, doctor. What causes otitis media in babies? So, otitis media, for those who don't know, the medical jargon is ear infection. And so, infection of the inner ear. So, the hairs of the middle hair, rather, the ears are divided into three parts. We have the external hair, that's one you can see outside. We have the long corridor, the the middle hair. Then we have the internal hair that is really where you actually hear from. So when there's infection in that middle part of the hair, we call it otitis media. And you can see the baby, they'll be tugging on their hairs, they'll be having hair pain, they'll be pulling on it, or they may even be discharging pus from the hair. So if you notice that, it means there's an infection, and it can be caused by viruses, bacteria. It can be caused by any of them. So any of them can cause such infection. And the most important thing is to get it treated. Most of the time, they're actually viruses. They don't need any treatment. You just need to give the baby painkillers. But sometimes if there's fever, there's frank pus, then we think of bacteria. We actually take that pus, send it to the lab. And when we do that, then we know which bacteria we're dealing with, then we can give the appropriate antibiotics. So I think that the most important thing is to make sure that you treat it. It's caused by germs, and there are many ways those germs can get into the hairs. But I don't really want to go into that because that's a lot more complex. But that's actually what causes otitis media. All right. Okay. So let's continue from Instagram.
Okay. TFK Bags. Can I clean my 15 weeks old baby mouth with cotton wool and warm water to avoid thrush?
Yeah, you should be cleaning the baby's mouth we should be cleaning the baby's mouth. Any baby from day one, you can clean them out, but use cloth. They clean, not cotton, because problem with cotton is that the strands can get kind of hooked into the baby's mouth. Our baby may swallow and all that. We want to be careful. So what the dentist recommend is that you use a clean face towel. A clean face towel, you can just use it to clean the mouth, wipe the tongue, wipe the gums, that's all, and it's fine. You don't need to do that to prevent thrush. It is just to clean the mouth, the mixed in, because mixed in is what you normally see on that tongue. It's not thrush. I really want you to understand the difference between mixed in and thrush, because mixed in is from the breast milk, so the mouth will be coated white. But when you clean it, you see that it comes off so easily and baby is fine. But for thrush, it will not come out. It will be so when you even forcefully remove it, it will leave like wounds, like bleeding and all that. So that is oral thrush. That one is a fungal infection, and that has to be treated with anti-fungal medication. So that is a different thing entirely. And the commonest cause of fungal infection in babies is when babies are given antibiotics unnecessarily, because what you do is that you kill off the good bacteria and then it's easier for germs, things like fungal infection to take root. So we try to, but it's a very common thing in babies. So it is not to prevent it, but it's to clean off mixed in. If you think your baby has oral thrush, you have to see a doctor who can prescribe appropriate antifungal medication. Okay, for me, let's do it one by one. Let's take Facebook. We want to see how I'm going to be doing this. All right, so somebody is asking, Juana is asking, is it advisable to apply lotion on newborn baby? Fantastic question. So actually, okay, let me first answer the question. It depends on what you mean by lotion. You can apply lotion or cream or whatever on newborn baby. There's nothing wrong with that. So, but the most important thing is that you don't go apply things that are too full of chemicals. So for babies, because their skin is so sensitive, we want you to apply what we call hypoallergenic products, things that have little or no chemical that the baby is not likely to react to. So we actually prefer things like olive oil, things like Vaseline, the pure Vaseline without perfume and all that. Some of those other baby products are okay as well, but some of them they have too much chemical because they want them to be smelling nice and good. So because of that, the babies can react to them. So you want to be very careful. So you find that most of the hospitals they use olive oil to wipe the baby. They don't use all those your fancy oils. So and that is enough. But if you use your normal baby lotion and the baby is fine with it, that's okay. But if you notice that the baby is coming out with rashes because of it, then stop it and just use any of those other natural products that I've mentioned, and I think that'll be okay. All right, so let's continue
Now,
from
back
Instagram.
to us. Okay. CFK back again. I noticed his ties after immunization of 14 weeks last week.
Mm.
The spots are still a bit hard. Is that okay?
It's fine. It's fine. As long as it's not painful, it's not red, it's not bringing out pus, it's fine. So what happens with that spot? Because mothers worry a lot about that spot. Is the fact that that injection, that 14 weeks injection is an intramuscular injection, goes deep into the muscle, so it leads to some bleeding. And whenever there is bleeding, there are what we call calcium, some agents in the body will come there to clot it. They will try to stop the bleeding. So in that process, they will form that clotting material that's we call it fibrin and all that. So that's what is there, and that is so it's not something to worry. To cake around the blood, but the body is going to remove it with time. The most important thing is that it doesn't become infected with bacteria, bringing out pus and all that. So, but the hardness, just don't worry about it. It will clear with time. All right. Olubumi Ajayi is asking, good evening, doctor. Thank you for everything you do. Thank you too for watching. 3 months old baby poo contain kata like mucus. Baby is on exclusive. Okay, I don't know what's the question. I always like people to ask me questions. This is information anyway. But I guess you are worried whether you should be worried about the kata in the stool or something. I want to assume. If my assumption is wrong, just update the question. So there's nothing to worry about. So most times there's a little bit of mucus that can come, it's the lining of the intestine and all that, but it's not worry as long as it's not babies passing like frank mucus of with blood or anything inside. So if it's just the mucus itself alone, there's really no reason to worry. But be careful what you are eating and what you're giving the child. So sometimes when you're giving some of these multivitamins, some of these drugs, sometimes they cause those kind of things and all that. But we worry about if it's just mucus alone or blood with the mucus or something like that. So that's when we worry. I don't think you really need to worry, and try as much as possible. Okay, so your baby is on exclusive, just continue exclusive breastfeeding. All right, thank you. Okay, back
Now,
to IG
blessing
family.
Shady. Okay, blessing Shady. Good evening, doctor. I have a question.
Yeah, go
I
ahead.
noticed some reactions. I noticed some reactions on my 8 months baby's face, and
Mm.
I was told it is infantile acne. Please,
Mm.
is there something you can recommend to help remove the reactions?
Okay, that question is really complex. Number one, I can't even recommend anything on hair without seeing a child. That is not ethical practice. Two, I can't. I'm not sure whether I even agree with what the person said. So I can't say they said. So and I'm wondering the person who said it. Why didn't the person tell you what to do or recommend something? So I don't follow that kind of thing. So I would rather say you post your question with a picture, if possible, on our Facebook group. Unfortunately, we can't do that on Instagram. We can't do that on live. So then we can look at the picture, and then we can
Sure,
say, okay,
that's
say
nice.
because there are some rashes in babies that are actually normal rashes. There's nothing. We have what we call milia and all those kind of things. They are normal. They will just clear. You don't even need to do anything. Sometimes I find out that this is the process of doing something. Then people create more problems. So that is why no doctor will treat a rash without seeing it. You have to see it. So you have to see it, and then you have to, okay, this is what it is. Because rashes sometimes look alike, and sometimes people mistake them for each other. So it's better to see, and then we can say, okay, this is what it is and all that. But what I would normally recommend generally for rashes in babies is like avoid things that, like I said earlier, chemicals, products that are full of chemicals. Just use mild, preferably natural products and all that on your baby's skin and all that, and then just watch. But if you're worried, of course, let a doctor see, and then beware of doing self-medication, because that's what people do a lot. And sometimes they create more problems. Some people, I see a lot of people using steroids on their baby skins and all that. They actually worsen most of these rashes. So you have to be very careful, unless it is like atopic dermatitis, for example. That's the one that we know that you should use steroid, and then it has to be used in a particular way. There's a dose, there's a duration, there's all those things. So it's not something you can keep using forever. And please don't put medication in your baby's cream. So those are my general recommendation. It doesn't matter what it is, but to be specific on what exactly is that reaction, we really need to see your child, and then we can advise for that. Okay, let's move on. Jane says my son of 5 months has mouth odor. I brushed the teeth this morning and it will still smell. Okay, so that's what the dentist will call halitosis. In a 5-month-old, the baby is just actually bringing out teeth. So I'm almost certain it has nothing to do with the teeth, because these teeth are just coming out. So which is not, when baby have dental caries, they can cause mouth odor. But in a 5-month-old who is just maybe causing the first set of teeth, is very unlikely. So, but there are other things in the mouth and in the throat that can cause mouth odor. So, for example, if your baby has adenoids, or has anything anything within the head and neck, even with the hair, with anything around that area, can actually manifest as mouth odor. So it can be a pointer to something else going on with the baby, not necessarily it's not the teeth. So it's not because you're not brushing the teeth. Like I said, your 5-month-old most likely has 4 teeth or max 8 teeth. So there's no way those teeth will be the one causing the mouth odor. So it is something else going on in the throat. So you really need to see your doctor, who will examine the child, look into the throat, and then be able to advise you, say, okay, it is this, and then this is what we're going to do about it. I hope that helps. All right. Okay, let's move on.
Now, Emerald's Air brand said it can't be removed. She's talking about the vaginal growth.
You really need to see. You really need to see the doctors. You need to go back to the hospital. I'm surprised they mixed that, because that's one of the reasons we do what we call baby check. We must always examine every baby born head to toe, looking for any abnormality, so that we can know whether we need to fix it or not. It may not be something major, something serious, but we need to know what it is. So I will advise going back and let them do it for you. All right. Ijoma say my 3-year-old is always having rashes on the armpit, between the thighs. It will go after applying cream, then come back here. Can it be yeast infection? No, infection don't come and go like that. Infections don't come and go, but infection can come on top of another rash. The rashes that tend to come and go are what we call like allergic conditions. They are conditions that once you are exposed to whatever is a trigger, it will come up again. So they things like atopic dermatitis and all that. So there are rashes like that. That is their natural issue. No matter what you do, they will keep coming and keep going until maybe sometimes children outgrows them. Sometimes even as adults, they will still keep having. But the most important thing for those kind of rashes that you really need to be observant what it is that when the child is exposed to, the rashes will come out. So some children it is the grass, some children it is the dust, some children it is even water, some children it's a particular soap, some children it's a particular food. So it's sometimes difficult for parents to know which one. So the best thing is to see a dermatologist, then they can now figure it out for you, because sometimes it's difficult. Sometimes even with the dermatology we don't know what it is. Sometimes we have to do allergic tests and all that. So but sometimes we just watch and wait it out. When there's an episode, we treat it, then it will go. There's nothing you can do. If there's itching, you can give something to reduce itching, like what we call like your purity and the rest of them. So that's all we do. There's really nothing we can do about that. So I think I would just recommend that you see your dermatologist, and then they can take it up from there. Yeah.
Okay. Now, she fell down. Good evening, Doc. My 3-year-old son is always having boil on his legs. We took him to the dermatologist and they said it's mosquito, but it doesn't look like mosquito. Please, what do you advise I do?
Okay, so if you have seen a dermatologist who is supposed to be the expert when it comes to skin disease, I don't really think I should have an advice because usually, even as a pediatrician, when I see a skin condition, I will treat some. But when I get to a point that I'm not so sure, then I say, okay, go and see the dermatologist. But the dermatologist's job is to see the skin. That's all they do. That's their area. So they are the best. So unless you are just, I'm not sure who you saw, because sometimes people say they've seen a particular specialist, but they've not actually seen a particular specialist. Not every doctor you see who is a specialist in that area. The fact that the doctor saw a skin disease does not mean the doctor is a specialist. But if the doctor is a specialist and he has told you this, what I would advise is that you go back to them and tell them, okay, I've tried what you said, it's not working. What is the next thing? Then, because usually for us, it's not because the doctor doesn't know what they're doing. In medicine, there's what we call differential diagnosis. In other words, there are things that look alike. So sometimes we think, oh, it could be A, B, C, or D. But we now go, okay, based on the age of this child, based on the this, based on that, it's most likely A. So we will treat it as A. But if we now treat A and it's not responding to the treatment for A, then we'll begin to think, oh, could it have been B? Could it have been C? That is how medicine work. We are not we are not like oracle. We don't always know everything. So we sometimes we have to think of possibilities. So the fact that your doctor says it's this and it is not this doesn't mean the doctor doesn't know what to do. That is how it works anywhere in the world. So we have to now investigate further. But we always know that these are the most common likely things. Like say you have fever now in Nigeria. People would think more of malaria in you before they think of any other thing else. Because you're a Nigerian, you live in a malaria environment. But there are other plenty causes of fever. For example, we not think of other things that are common in maybe flu. Nobody will think of flu in you because flu is something they see in abroad. So that is how doctors make diagnosis. So the best thing is to go back to that same doctor because the doctor already knows what they've excluded. Then they will know what else are still in their list that are likely going to be. So I don't think recurrent boils should be confused with mosquito bites. Maybe they saw it for the first time, but now that it's coming back again, then you have to go back to them. Then they are going to be sure what it is. So, but the dermatologist is actually your best, your best bet when it comes to skin condition because that's their field really. But you can seek a second opinion. You can go to another hospital, maybe a teaching hospital, if you are not satisfied with the one you got before. But I think they are still the best to say your condition. All right, I think I can take one more question here. Okay, Nikki is saying, which drug can I use for my baby after taking a vaccination? No drug. You don't need to take any drug if your baby has taken vaccine. Vaccine itself is a drug. So your baby doesn't need any medication, but I know what you are saying. So when your baby has taken vaccine, you don't need to give them any drug. That is the honest truth. But if your baby has side effects of the vaccine, which is not automatic. So for example, the baby can have fever, then you can give paracetamol. That's all. If baby has fever, you can give paracetamol, you can give ibuprofen. But otherwise, you don't really need to give anything. And it's not automatic that once your baby has vaccination, you must give something. There are some vaccines that your baby would take. They don't even know they've taken nothing. They don't have fever. They don't have nothing. Most children with BCG and all that, they don't react to anything. They are okay. Most children with measles and yellow fever, they don't have any reaction. They are okay. The DPT, the Penta, tend to give them fever, so you give paracetamol. But otherwise, you don't need to give medications routinely after vaccination. Nikki, how that helps. Okay, let's move on.
Good evening, doctor. My 1 month plus babies, preterm in brackets, have reflux, colic also. It's as if their airways or chest are not clear because it makes noise as mucus, especially when they are eating. They groan and stretch a lot.
Yeah.
I'm a first time mom and I'm worried.
Yeah, they are all those things are fine. They are part of normal. You don't even need to tell me you're a first time mom before I know you're a first time mom because I can see all the signs of a first time mom flashing to me. Okay, so you are right. Is babies can have colic, they can have reflux, they can have all those things, but they are what I call minor disorders in babies. They are nothing to worry about, and all those noise you hear is also part of it because in babies, their airway, the muscles around those places, they are not yet fully formed. In adults, your airway is very rigid. It's like a big pipe. So air is flowing through, you don't hear any noise. But in babies, it's like plastic, something very flexible. So when hair goes in, it goes like this. It's not steady. So because of that, you hear a lot of noise. But it doesn't mean baby is having any breathing difficulty and all that. So there's that noise could be normal, but you need to be careful because there are also some noise that could be abnormal. So for example, the baby could be having breathing difficulties, but there is a way to know. For example, a baby who is eating well, sleeping well, even though you are hearing all those noise, but baby is otherwise okay, is very unlikely to have any issues. But if baby is struggling to breathe, baby cannot even suck, baby cannot eat well, you will just know that this baby is very uncomfortable. The nose are all flaring and all that. And of course, I believe you've seen your pediatrician before you were disturbed because you say your babies are preterm. So they will be able to look at it and say, okay, no, this is fine. So you really need to look at the baby. If your baby is otherwise well, eating well, he's sleeping well, all those stretching and groaning is normal. These babies are very sensitive to their body because their body is everything is new to them. So anything passing through, even hair, even water, even stool passing through them, they react to it like, oh, what is that? What is that? So they stretch, they do all those things. Even when they want to pass through and the stool is normal, they will still groan and all that. There's nothing to worry about. So all those things are what I call just watch it. You don't need to do anything. They will come to pass, they will go away. As they get bigger, they too are more familiar with their body. You see that all those things tend to kind of stop on their own. You don't need to worry. For reflux, keep them upright after feeding them. Don't put them to sleep immediately. Let them lie flat. I mean, let them lie vertical. Like, put them on your shoulder. If you are worried about, you have 1,000,001 things to do, put them in your car seat, let them sit it up so that the food can stay down a little bit and all that. So that helps. So with time, as they get bigger, all those things tend to resolve. So there's really no reason for you to worry or to panic to come to pass. All right, thank you. Let me just go to Blessing on Facebook. What can I give a 2-month-old constipated baby? Now that question is very pregnant. So what do you mean by constipation in a 2-month-old? Yeah. So now in a 2-month-old, they may not pass stool every day. And that is not constipation. They may not even pass stool if your baby is on breast milk only. Your baby may not pass stool for 2 weeks, and that is still not constipation. Because when they eventually pass the stool, it will be perfectly normal stool. Baby is otherwise well, baby is not vomiting, their tummy is not swollen. This is a well, healthy baby. So if that's the situation your baby, it is not, we don't call it constipation, that is normal. But if your baby is struggling to pass stool, the stool is very hard, which I find very difficult to believe, which is very rare in a newborn. The stool is very hard and the baby is struggling, the tummy is swollen, baby is vomiting. Yes, that baby is really constipated. That baby needs to see a pediatrician because constipation in that age is usually suggestive of abnormalities within the gastrointestinal tract. Things like what we call H-prong disease and all that. So you really need to see a pediatrician. But if it's just a well baby, smiling, eating, but maybe the baby is farting a lot and but just not passing through, that baby is fine. It's not constipated. Just keep breastfeeding. But when baby will eventually pass this stool, it will give you a very bulky or normal pasty stool. It won't be like hard pellets or anything like that. So that is how we define constipation. So in newborns, the way you think is constipation may be different from the way we think. So that's why when people say, I don't like using words like constipation, diarrhea, I prefer you tell me this is exactly what the baby is doing, then I can figure it out whether it's really constipation or not. So I hope blessing that helps. Okay, let's go on for me.
Now, mental mama, please, baby is 1. Can she start taking beverages?
Yes, they can start taking from 1 year. Congratulations. But please don't feel their tummy only with beverages. So, and let it be LD ones. Just let them eat normal food because sometimes mother just gives their children tea all the time. Then baby will not eat, and the baby doesn't eat. When their tummy is full of tea, what would they eat? Why would they want to eat? So let's be balanced. Okay, I think I can take mine as well. All right, Rebecca said my baby is 2 weeks and it's pop. How is Pope supposed to look? Okay, how is this? Okay. I think it's the same. I'm not sure whether it's the same mom. I think so. Okay, it's not the same mom. Okay, I'm not sure whether I understand. Is it the stool you're asking about? Because you say pop, so I'm not really sure. But in a newborn baby, their stool is not hard like yours. It is not what it's not completely like water like urine. It's in between the two. I use for those who are Nigerian, I tend to use like the concept of melon soup or egusi soup. You know your egusi soup, you have some part that are like thick, and then you have some part that are a little bit like water and mix together. That's the kind of picture of stool that you get in babies who are on exclusive breastfeeding. And the frequency of the stooling can vary. They can vary from passing the stool like every feed. They can pass 12 up to 12 times a day. In other words, every time they eat, they will stool, because some mothers worry about that. Or they can go to the other extreme of not passing stool at all, like the other questions I just answered. For 2 weeks, no stool. So it's and all both extreme are normal. As long as the baby is there is well, baby is fine, baby is sucking, so that's fine. So there's no reason. I hope that answers your question. But for somebody like Rebecca, I'm coming up with a course which is actually coming up next month, and for the first time mom. So you will do like a course for 12 weeks. After that, you will know everything you need to know about raising a newborn baby, taking care of your baby, what is normal, what is abnormal, what are the all these your questions already would have been answered in that course. So just watch out for that course and make sure you sign up for it when it's out. Of course, it's not free, but at least, but I'm sure that it's a worthy investment that you're going to enjoy. Just watch out for FTM Baby Care Ready program coming up soon. All right. Okay, let's go back to my Instagram family.
Okay. Dr. Alex.
Hmm.
I hope I get that right. Hello, ATP.
Yeah.
Apart from methylated spirit and cotton wool to clean a cut on my 4-month-old baby due to the use of nail cutter, is there any other thing I should do? Bleeding has stopped though.
To clean what? What happened?
The baby has a cut on the finger due to the use of nail cutter.
Oh. Sorry, baby. There's nothing else to do. It will heal now. It's just like any other normal wound, it will heal. But please, please, don't cut babies' nails when they are awake. Don't do it. That's the problem. Because they won't be still. They won't be still for you to do it. Don't cut their nails when they are awake. Don't use blade to cut their nails. All this. So cut your baby's nails when they are sleeping. And please there are scissors and there are the nail cutter for babies. Very simple. So if you do it that way, you will not have any problems. So please, let's be careful. All right. Thank you. All right. I'm going to go to Facebook. Taufik is asking, my 7-month-old sweats on the head too much. Others in the room are not feeling the heat. What could be the cause? Number one, it depends on the temperature of the room, because normally babies they generate more heat because, for example, when they suck, when they do all those things, they can appear to sweat a lot more. So the fact that you guys have a way of dealing with your own heat, they are not as efficient. So if the room is hot for the baby, then baby is going to sweat. So I will not think there's a problem with that. So as long as I will worry only like if the weather is like freezing cold and your baby is still sweating in freezing cold weather. But some of us sweat even, depending on, everybody has their own mechanism. So if you put on the AC, for example, and your child is sweating and maybe the AC is at 18 or 16, then I will worry about that. And then I will say see a pediatrician to know whether there's something else going on with the baby. But just using other people to judge me not necessary, and then maybe can sweat a lot more, especially when they just finish sucking or feeding, because it takes a lot of energy to do all those activities. So I think I'll just say don't worry about that, unless, like I said, it's really extreme, like you put the baby in a ice cold room, and the child is sweating, then I will worry about that. Yes. Okay. Me.
Now, Dr. Alet again.
Okay.
What is the difference between choking and aspiration in babies?
Well, I think that's a semantics, really, but it's a little bit slightly different. But you can actually use both of them interchangeably. But most time when we use choking, we tend to talk more of solids. But when we use aspiration, we tend to talk more of liquids. So if a child is, but both of them is like I said, you can use them interchangeably. So it just basically means something is in the wrong area. For both of them, there's something in the wrong pipe. So the hair pipe is supposed to have only hair. So if liquid or solid goes into those pipe for hair, that is, if it is solid, it's choking. If it is liquid, it's aspiration. So it's the same thing. But sometimes people just we just use it together. Interchangeably. So you can choke on food, liquid, and all that. You can aspirate liquid. You can, doesn't matter. I think it doesn't. The most important is that please, a choking baby or a child who is aspirating is an emergency. That is the most important thing. You must know what to do if a child is choking near you. So if it's a little baby, like a 1 year old, less than 1 year old, put them on your. If they are choking on solid, put them on your palm, or like you put their head down. I don't know whether everybody can see me, and then you just give them five back slaps. You just slap in between their shoulders, just slap it, slap it, slap it. Whatever is there will come off. If it's an older child, you can do what we call Emlek maneuver. You put your hands around the abdomen, you put the other hand around it, and just thrust it forward. If it's a child that can cough, just a child cough out, then you can cough. So those are, if you are not getting a headway with any of those in hospital, straight emergency room is an emergency. So those are, but I think it's more of a semantics really, but it just basically means something is going in the wrong pipe and it's an emergency. All right, thank you everybody. I've got a question here. Okay, yeah. SC is asking, my doctor, please, is prolonged use of cacatin cream plus shea butter unsafe for a baby? The rashes keep coming and going. Yes, please, I've mentioned this and I keep singing it. Please never use cream that are medication for your babies or mix it into their cream. Don't. It's wrong. Those products are drugs, and we don't use drugs continuously forever. I know some of you are frustrated because those rashes keep coming and going, and you realize that once you use those particular cream, the baby will be fine. But what you're doing is that most of those creams, especially the one that contains steroids or antibiotics, is dangerous because those creams, the skin is the largest organ in the body. Everything you put on the skin is absorbed straight into your blood. So if you are putting like steroids on your baby's skin every day, it's going straight into their blood, and you just go and research side effects of steroids. It can cause growth failure, it can cause ulcer, it can cause even your baby to start having what look like diabetes, it can cause so many things, obesity and all that. So steroids, we don't use steroids, like even for children that need steroids all the time, like that is the treatment for their medication. We try not to give them all the time. We try to give them period, even when we can either reduce it or all that, because we want to avoid those side effects. And these are even children that really need the steroids. Not to talk of children who don't even need it. So if your child has rashes, don't self-medicate, don't use medication in their cream. Take them to see your doctors. Like I've told you, some of us, some skin rashes are not going to go away. They are going to go and come back because that is the way it works. That's how it is. The dermatologist doesn't have a magical solution. So don't even bother. There's no drug there's nothing like, for example, if your child has atopic dermatitis, there's nothing that's going to clear it completely. It will keep going and coming. So what we normally do is that when it comes, we will treat that 1 or 2 weeks and let it have a break. When it come back again, we treat it again. But you can't just keep using that same drug forever. You are causing long-term damage to the child. So please avoid um mixing medications into your. So even though they are like creams, they are still drugs. It's just a drug in a cream form. So you can't just keep giving drugs to your children continuously. Please stop it and see a dermatologist for further management of your child's whatever skin condition. All right, I hope that it helps. Okay, come in.
Yeah, okay. Back to bed. They are sleeping and eating very well. Thanks so much.
Okay, yeah, I already know they will be sleeping and eating well, so I already know that. I know.
Okay. Now, Muna 0124. Good evening, Doc.
Yeah,
My
good evening.
7 months has been pooing frequently in the last 4 days.
Mm.
It's sometimes sticky, sometimes watery. sometimes has mucus. It is usually in very tiny quantity. Is this normal? Okay,
Well,
continuation. It poops as much as 6 times as against 2 times a day when we started complementary feeding.
okay, yeah. So for you already, I don't know where the answer is. So it has to do with maybe the change in diet. Maybe did you just introduce something new? There's something new in the diet and all that. Because if it is like it's watery all the time, then we know it's diarrhea and ORS and the rest. But if it is once in is watery at times, it's normal at times, it's small at times, check what the child is eating. Is it check the food you're giving? Is something new? Any medication the child is taking? Is there anything that could affect his bowel habits? Basically, that just alter his system. But like, let me just give a general answer. It doesn't matter how many times your baby passes stool in a day. That is not our problem. It's fine as long as the stool are normal stools. It doesn't matter. So whether the baby passed stool 6 times, 12 times, 100 times, as long as it's not watery, we are not worried. As long as it's not hard like pellets, we are not worried. So because I noticed that more parents worry, oh, my baby is passing stool, it's passing stool 2 times, for now it's passing 6 times. But the stools are all still normal stool, they are not watery stool. There's no reason to. You may just watch what the child has eaten. Maybe the child has eaten something that is a maybe that doesn't really get gel well with the system, and then they tend to feel like. I'm sure most of us have experienced what I'm saying. There's time you use certain food and you just want to go to the toilet all the time. So you may just want to watch that, but otherwise, I would not worry about it, to be honest. Okay, all right. Let's go on. Okay, I can see Aris. Thank you, Aris, for joining me. Okay, Olubumi is saying my 3 month old sucks for hardly suck for 5 minutes at a go and poo sometimes finish 2 years, though healthy and active. How do you know the baby is healthy and active? That is for the pediatrician to decide. Okay, because immediately you told me your baby is sucking only for 5 minutes. I'm not surprised the baby is having greenish too, because greenish too is already telling me that your baby is starving. That baby is not getting enough breast milk. So your story is actually very sync. I mean, they are in sync. So the weight is progressive. That weight progressive doesn't really make anything. You have to tell me what is the current weight, what was the old weight. But I guess you mean the baby is adding weight. That is good. At least baby is not losing weight. That is good. But I really need to be sure the baby adding exactly what we expect. For example, if you're supposed to add 1 kilo and you added 100 grams, you've added weight, but you are still not adding weight properly. Yeah. So what could be wrong? Milk is flowing well. Yeah. So exclusive breastfeeding. So what I most likely suspect is poor attachment to the breast. If your milk is flowing well and the babies want to suck, but baby suck for 5 minutes and is tired, it means baby is sucking on the nipple and not on the breast on the areola. So I would recommend you watch our breastfeeding videos. I guess you're also a FTM, so you really need to do my FTM baby care program. So there's a way to attach your baby to the breast, because baby will get frustrated when they suck and nothing is coming out. So that's why they will suck for 5 minutes and take away them out, because there's nothing coming out and the baby is tired. So you will notice that if you now express your breast milk and give that baby, the baby will finish it. So yeah, so you really need to check that, how am I giving my baby the breast? So when you put the breast in the mouth of your baby, the whole of that nipple is not what the baby needs. The part beyond the nipple, that dark part beyond the nipple, what we call the areola, that is actually where the breast sinus is the store. That is where the store of the milk are. So you need to make sure that you put the nipple and that areola into the mouth of the baby. Sometimes when baby are rushing, they just quickly grab the nipple. There's a way you can use your finger, you just put it in their mouth and depress it, their mouth will open, then you make the breast will come out. Then you make sure that you really put it in well. When you put your milk, when you put your breast well into the mouth of your baby, you should only barely see that black part. You should barely see it. You should barely see it. The majority of it should be in the mouth of the baby. And when the baby grab on that one, the milk will flow, and then you can hear the baby sucking and swallowing. And usually when they are sucking and swallowing, they will be full, they will suck well, and most times they will sleep afterwards. They will be you will see the tummy is full, the baby is well satiated. At least baby should suck much less than 10 to 20 minutes on each breast, and you should feel your breast deflating, like something is your breast is full at the beginning, then you see it like is almost empty. You will feel it. I mean, all of us know what I'm talking about. If you have ever breastfed, then you can change to the other side and you will know. So that is it. So and another problem that can cause this kind of situation is if the baby is sick. Like some babies have heart problem and they can't suck because they don't have the energy. But that is even a rarer condition. The commonest is that poor attachment of the baby to the breast. So, but luckily we have what we call breastfeeding videos. It's on our Facebook group, it's on our YouTube channel, it's everywhere. Just Google breastfeeding videos. When you watch them, you will see how to properly attach your baby to the breast. Or if you have a nurse, a matron, a midwife, they can also guide you. A pediatrician, we can show you how to do it. But it's very easy if you follow some of what I've said. You find out that it's very straightforward to exclusively breastfeed your baby, and your baby must suck at least 10 to 20 minutes. You must feel your breast filling up. So for you can also see express and give the baby her stop up while you are sorting out the attachments of the baby to the breast. Anyway, okay, let's move on. I think what time is
Okay. Okay. Part 2 again. Please, when is the course?
When?
When is the
Yes, it will be ready. It's ready. We're putting the final touches on it. So you will hear about it. Don't worry, I'm going to tell you. But it's going to be ready this September. I think maybe I just need to make sure everything is set. Maybe we'll do the second week of September. Yeah, so just watch out for it. It's going to be something you can go and do on your own. So don't worry, we'll let you know. I just want to make sure everything is set. But the course itself is ready. I'm sure you're going to love it. Yes. Okay. You ask your question?
Mm. Hello, my boy of 4 years old, after eating, always visit the toilet. Hope there is no problem.
There's no problem.
4 years old.
There's no problem. There's what we call, even it happens to some adults, what we call gastrocolic reflex. So that reflex means immediately you eat, there's a message from your stomach to your intestine to the rectum where the stool is stored. So it kind of relaxes it, and then you feel that urge. So some of us as adults, you may be able to control it and feel like, let me see, hold on, so that people will not call me a large. But children may not be. But still, to be honest, it's a normal physiological thing. There's really nothing wrong with baby. As long as the stool is normal, there's nothing wrong. And the baby is not going to stool out the food. It just ends, because some mothers always think that means that the food that just entered their stomach now, they're already gone to say, no, that's not the one. It's the one he has eaten before that is going to take out, that's been digested. All right. So Vivian is saying, what's the cause of convulsion? What's the cure for it? Well, that's a whole lecture because convulsion is a whole lecture. So convulsion can be caused by, there's type of convulsion be caused by fever, high fever, and there's convulsion that is not caused by fever. And there are many things in the brain, like any problem in the brain can cause convulsion. So it's a huge question, and we don't really say there's a cure for convulsion, to be honest. We just treat the convulsion and the cause of the convulsion. For example, if a child has a brain tumor and is having convulsion, if you take out the tumor, the convulsion will stop. So, but sometimes there are some convulsions we don't know the cause, so we don't even have treatment. So we can't treat the underlying cause, but we can treat the convulsion itself. We can give drugs to stop the convulsion. So, Vivian, you need to go to our website, www.askthepediatricians.com. There are 2 articles on convulsion there, very detailed, that I've written. You can read it. You will understand everything about convulsion. And if a child has convulsion, please, that child should see a pediatrician. Don't go to local herbal people or wherever. It's not Pamcane, it's not this. No, the child needs to see a pediatrician. And the earlier we treat it, the better. If not, the more convulsion a child has, the more brain damage. A child may not even have convulsion because of brain damage. But if the convulsion is now not properly treated, it can actually cause brain damage. So please, a child who is convulsing is an emergency. A child who is convulsing is an emergency. That child must be taken to the emergency room. Even if the convulsion stop, you must still take the child to the emergency room, because we still need to know why the child has convulsion. We still need to sort it out. I've seen a lot of children, a lot of family with convulsing children. These children have been convulsing forever. Nobody ever take them to the hospital. It's only when it becomes embarrassing. Please, it's an emergency. Any child convulsing, you must take them to the hospital straight away. All right, so let's move on. With our time.
Muna, I just increased this formula from 4 scoops to 4 scoops from 3 scoops. Could that be the problem? She was complaining about the frequent poo that the boy is pooing from 2 times to 6 times
Is
now.
he 4 year old or 4 month old?
No. 7 months.
Oh,
She
what?
complained that her 7 months baby was pooing frequently.
Okay,
That
yes, I remember
anything
that
she
other question
vomit.
now. Okay, I remember the question. No, that's fine. But just be sure the way you are adding the formula. Are you because formula has to be mixed with the right quantity of water, even if you are not giving it as water, if it's pap. So for example, some of them will say 1 scoop should go to 30 mils of water. So if you are giving pap to it, must be 30 mils of pap to. If not, it means the milk is too concentrated, and that can cause that kind of a problem because you are causing what we call osmotic, let's not talk medical jargon, but you are drawing water into the into the intestine. So please make sure if you are putting milk. I know some of us just think some of those things we do it as the spirit leads us. You just add as many scoops as you like. No, it is not. There's a ratio. It's always on the tin. You just go and read it. When you finish now, go and look at the tin. They will write you 1 scoop to this volume of water. It must be followed. If not, it can cause that scenario as well. Okay, somebody is asking question. My baby birth weight is 2.8 kg. It's now 5 kg at 15 weeks. This is okay. It is okay. So Nena, there's an article on how you can do it yourself. How you can know whether your baby is gaining weight adequately and all that. Mother has that question a lot. So, and I think it's something everybody can do on their own. So just go to our website. What is my ideal baby's weight? That's the article. Read it. It's very simple. Babies double. I can teach you very easy one now. Babies double their birth weight at 5 to 6 months, and they triple it at 1 year, and they quadruple it at 2 years. If you remember that, as long as your baby is falling between. So, for example, now your baby is almost five. Your baby is almost doubling his birth weight at almost 4 months, and normally I expect the baby to double it at 5 to 6 months. Then definitely that means that baby's weight is okay. I don't even need to do a lot of calculation. Then another one is babies gain 30 grams per day. The weight they had every day averagely is 30 grams for the term babies. For the preterm babies, they do it 20 grams a day. So you can also do that calculation. Those of you who love maths, you can work it out. So I guess that will help. So, but then you also have your weight chart, all your immunization card, all your baby cards. They have a place where they put weight, and they have a graph. If you draw that graph, if you plot it, if you still remember your maths, you will know that whether the child is following the normal curve or is dropping out of the curve. So, but between those three methods, last case scenario, just go online, look for apps. There are many weight apps for babies. Just put the age of your baby, put the weight, put the gender. They will tell you whether the weight is normal or not. So you have options. So you can know your baby's weight. All right. Okay, let's move on.
Okay, now Dr. Alex, a
Ah,
friend saw her baby's nose blocked with a whitish substance,
hmm,
breast milk in bracket, and he was struggling to breathe. He
hmm.
is fine now. Could she have used the back slabs as first aid?
No. Your baby has something. Your baby is not really aspirating. Your baby is. I didn't know it's breast milk that is in the nose of your baby because it's a little bit. Breast milk don't clog nose, like they will stay there and you can see it. So the only thing that could be white in a mucus in a nose of a baby is mucus. So if it is breast milk, it will flow out. It won't stay enough for you to be seeing it unless the baby had a reflux and the milk flows out of the nose, which is possible, but it won't be like the milk is stuck in the nose. I don't know whether I'm making sense to you. So, but anyway,
Yes.
the most important thing is that your baby is fine now. So I don't think it's not that back. No, that one is not backslap. Backslap is a baby who is really choking, like something is blocking the throat. The baby, you will see, if you ever see somebody who is choking, you will know it's as if they can't breathe. They're struggling. Your baby, if it is breast milk, is likely aspiration, but aspiration is a little bit. The most important thing is to clean out the liquid and then take the child to hospital. It depends on whether it's mild or severe. If it's mild, the baby usually will clear out the thing by himself. or herself. But if it is severe, you have to get to the hospital because it means the lungs have been flooded with milk, and that has to be sorted by the doctors. So, but I strongly believe what your baby has in the nose is mucus and not breast milk. Anyway, let me go on. Time is running. We have 5 more minutes. Okay, let me just say that if we don't answer your question, because today is my first day of doing an experiment of going live on YouTube, on Facebook, and on Instagram
Facebook.
simultaneously. And I can see that Facebook people seem to love to be here more than Instagram people. So maybe we should do more Facebook then. All right. So if you don't have, if you're unable to answer your question after the program, you can go to our Facebook group and ask your question there. We will answer your question Monday to Saturday. We will always answer your question, so you don't have to wait for Instagram live on Mondays and Fridays. You can, or now I'm going to be calling it ATP Live Mondays, ATP Live Friday, because we are going live on 3 channels. So you can ask your question on our group all the time. For I still get a lot of messages, DM a lot from Instagram family. Unfortunately, we can't do DM for answering questions. There are reasons why we can't do that, because the Instagram is not even manned by a doctor all the time. So I'm not the only one on the Instagram. So other people are also on Instagram. We may not be able to answer your question. So, but if you go to our Facebook group, we have a lot of hands. For example, if you have a question that is a dental related question, the dentist cannot come into our Instagram to answer your question in the DM, because the dentists don't have access to our DM in Instagram. I hope it makes sense. So but if you ask on Facebook, I can say, okay, Dr. Buki, this is a dental question. Then she will answer it. If you ask a question about dermatology, dermatologist can answer. If you ask a question about the eyes or a surgical question, Dr. Oge can answer that. But if you do it in DM, maybe it's somebody, one of our moderators who is on the DM, the person will not even be able to answer your question. So that is why we can't do DM. So people always assume that Obemi is always in the DM. I'm not. So you have to post your question on the Facebook, or you can download our mobile app, post your questions there, and we will answer it. And we have also introduced ATP question of the day now. So you're going to be getting one question answered every day. It's going to be on YouTube. It's going to be on Instagram. I don't think we're going to put it on Facebook because Facebook people are already having questions answered anyway. So you can also watch that program. I'm sure you will love it as well. So that's just because I know that in 1 hour, Instagram is going to cut us off and we will have time to answer any more questions. Okay, let me just answer the questions on Facebook. 3-year-old find it difficult to eat. I can't really have any particular food he likes. Okay, so yes, last week I have a pediatric nutritionist, 1 hour on Instagram answering all questions about food. So please, if you have any question about food, appetite, not eating, please watch ATP Live on Friday. It's on our IGTV. Every program is on the IGTV, so you can watch it again and answer it. Or Chinaya, since you're on Facebook, you can go to our Facebook group, go to the unit section, go and do unit 102 on complementary feeding. Every question, everything you need to know about feeding your child is there, including picky eaters and all that. Okay, final question. Okay, I think I'm just going to. We have 3 more minutes. Okay, do you have any question on Instagram? I think we can close Instagram, then I will finish with Facebook, and then I will round it off from there. Yeah.
Okay. Dr. Wade, when is overweight and obesity in a baby a problem? I thought genetics is a factor and the weight. Will they become normal as they become more active by crawling or walking?
Yeah, obesity is always a problem in anybody, even in a baby. But we need to know what is your definition of obesity. So we need to know the weight of the baby first. So some babies are a little bit fat growing up, but as they get older, they lose their baby fat. As they begin to crawl, as they begin to run, all those fats will go away. But there's a level of it that even we need to investigate. So the endocrinologists may need to investigate to know that there are some what we call syndromes or genetic conditions that come with overweight. So it is not because baby is eating or anything. It's a disorder, it's a endocrine disorder or something. So we need to rule out those ones first. So if your baby is overweight or obese, it's better to see a doctor first. Oh, time is done. We need to go now. So you see your doctor first, and then they will take it off from there. Okay, Instagram family, we have to say bye-bye to you right now. So we'll see you again on Friday at 6 p.m. Fumi, thank you. Fumi, your final word.
All right. Thank you very much.
2 seconds.
Don't forget to follow us on Facebook, Instagram, Twitter, YouTube. You ask all your questions and you get answers today.
Bye. Okay, Instagram is ended. Let me just finish answering those on Facebook so that we can end it on Facebook. Okay, so I think I've answered the person about the in nutrition. Now, the person asking about my baby swallow is poisonous substance you should administer milk. Please, what kind of milk? What's poisonous substance? It's not like anything poisonous you should administer milk. You need to take the baby to the hospital. You've not even told me what the poisonous substance. The only thing people are saying about milk is, for example, if your baby took kerosene or something like that, those ones that we say don't give palm oil, give milk, then take the child to the hospital. But some poisonous substance, we really need to know what poisonous substance it is, and then we can now know what we need to do about it. So I can't even say what it is. What I would just say is that you need to take that child to the hospital, for example. So yeah. Okay, so Brenda is saying what first aid can be given to a convulsing child. So a child who is convulsing needs to, there's not much first aid you can give. The most important is that you keep the child safe. You keep the child from injuring themselves. So what you need to do is to remove any tight clothes, any bangles, anything around the area that can injure the child. Put the child on their side, so, and let the convulsion finish. Don't put anything in their mouth. Don't put onions in their face. Don't put spirit in their eyes. Don't rub olive oil. Don't put anything in their mouth. Don't try to force their teeth open. Some of you don't put their feet in fire. Don't put their hands in fire. Don't do any of those things. People do those things and cause more problems for us, because that is what we will now be dealing with after the conversion has stopped. Most conversion will stop within 5 minutes. If the conversion is not stopping in 5 minutes, you should call the ambulance and take the child to the hospital. So, but all you need to do is make sure the child doesn't injure themselves and then take them to the hospital. The only people that can stop conversions are the doctors, because we have to give the child an injection. Or some people that their children have convulsion regularly would have given them some medication that they can put into the anus. But otherwise, all the convulsion has to be stopped in the hospital. You can wait for the convulsion to stop on its own and take the child to the hospital. But if it's not stopping in 5 minutes, call the ambulance or call the emergency services, take your child to the hospital. But most important is that the child does not injure themselves. That's not the time to crowd around the child. That's not the time to pour water on them. That's not the time to do any of those things. Just make sure that any tight clothing is removed, any chains, bangles, anything that can injure them, and let it stop, and then take them to the hospital. Again, you can read more about convulsion, what to do, what not to do on our website. Okay. And Musumala is saying, my question is, my baby's weight is 2.4 kilo, but now weigh 4.5 at 11 weeks. I hope the weight is okay. She stretches a lot when sleeping. It's okay. She scratches her head. I hope there's no rashes in the head. Make sure you wash your baby's head with a shampoo every day. And then make sure there are no like rashes or scales or those things. Comb it out. If there are any rashes, then you may need to see a doctor so that we can treat that, because that may be the reason. And don't just be pouring oil on the baby's head all the time, which is what some of us do, and that can also cause a problem. Okay, Quadra Diet is saying my 2-year-old stool is whitish like a goosey soup. And when they both eat yam, it comes undigested. This I know. Yeah, babies can, children at that age, we call it toddlers diarrhea. They can pass out undigested food in their stool, which is normal, But your baby's stool should not be white all the time. It should not be white. That's not normal. It should be brownish, that kind of a thing. So if it is white all the time, then I really think you should see a doctor, because we really need to know why. Because most when digestion is going on, there's what we call bile, and the bile job is to color the stool. So if your baby is passing stool that has no color, then that means there's something wrong in terms of that bile process or production, and it's something we really need to sort out quickly. So I'll recommend. Okay, good evening, all the people that are greeting me. Thank you so much. Well, rounding up, I just want to make sure I've answered all those who have asked their questions. And please don't ask more questions. Any more questions after 7, I will just post it on the Facebook group. Obiajun, is there any cure for anemia anhydrosil? It can resolve on its own. Sometimes you don't need surgery, it can resolve on its own. But if you have seen your surgeon and they've told you it's going to need surgery, do surgery. It's a minor surgery. It's not a surgery it's a day surgery. You do it, your child goes home, the child is eating. It's not a surgery that you should worry about at all. So just go for it. It's a very simple, straightforward surgery. But if sometimes the surgeon would have told you, let's watch whether it will resolve on its own. But if they've told you it needs surgery, just do surgery. Don't worry, it's not something to worry about. For me, Precious saying, what can I do? My baby's hair, she's on hip hair is falling off, and the scalp is more fair than her face. Or if the scalp is more fair than her face, that means your baby has most likely a fungal rash. Yes, you don't need to believe, but they are just telling you. You don't have to believe what they say, but from what you've told me, your baby has a rash, and that is why the color is different, and that's why her hair is falling off, and that means she needs treatment for that fungal rash, and you should see the doctor. Yeah. Butter is saying, can I give my baby Ezel Clear? I don't even know what Ezel Clear is. So, drugs have different brand names. So you have to tell me what is the active content. For example, if you say paracetamol can be Panadol, can be Emsol, can be Mcap, can be Avipol, can be acetaminophen, Tylenol, different brand names for the same, but all of us know it's paracetamol that's inside. So you have to tell me what exactly is in this Exe, whatever Clear. I'm suspecting it's something to treat maybe eczema based on the name, but have no clue what is inside. So don't use any medication your doctor has not prescribed. Make sure it is something prescribed by your doctor. Please, please, please. And Fumilayo is saying, my baby is 10 weeks and the number is not yet closed. What do you mean not yet closed? Has the cord dropped or not dropped? Or you mean the cord has dropped, but it is not yet fully healed? If it's not yet fully healed, it's nothing to worry about. Just keep cleaning, it will eventually heal. If it's that the cord has not dropped, then please see your pediatrician and we'll take it up from there. Okay, yeah. China, yeah. Okay, your baby's weight is 12 kilos. I'm trying to remember what you asked before. Unfortunately, I've lost track of what you asked. But if I'm not so sure. You need to tell me the age and the weight now because I've lost track of what your initial question is. Okay, Amarachi is asking question. Okay, Amarachi is helping me to post from the watch party. Thank you, Amarachi. My baby is just 2 months and I'm seeing something like eczema on his face. What should I use? We need to see what is this eczema. I guess baby has to rash. So there are many rashes in babies. Is it a rash that is normal that we don't need to treat anything, or is it a rash that requires us to do something about? Without seeing it, I can't even say this is what you should use, and I can't go by what parents say because parents use different terminologies for different rashes. Everything is eczema, but there are like 10 different kind of rashes that everybody call eczema. So we need to see it to be able to tell you what it is you need to do. All right, thank you so much. Thank you to people who are watching on Watch Party. Okay, what I say, my 13-month-old rejected breast milk for 4 days, and yesterday she came for it, and I gave it to her. And I opened to her. Why would it hammer? It won't hammer. Don't worry, your breast milk has not gone sour. Trust me, your breast milk is fine. Just keep giving the baby the breast milk. Okay, I know people believe that when you don't breastfeed for a while, the breast milk goes sour. That's nonsense. There's nothing wrong with your breast milk. Okay, Akinoye is saying, what causes the baby to sweat when the weather is cool? Like I said, babies, they do a lot of work. That sucking is a lot of work. So sometimes they sweat because of that. So it's not something to worry about. So I know most babies sweat more than us because they don't have as much fats and space and all those things to handle their own heat, so they just have to let her out. But if your baby is like everybody is stone cold, I mean the weather is, the AC is 16 degrees and your baby is also sweating, then maybe you should see your pediatrician. Okay, I think I'm rounding up now. Tony is saying, well done, ma'am. My girl of 2 years has been having boil on her scalp after antibiotic has been administered twice. Then we need to see your baby again to know why is your baby having. Are you doing the hair of the baby? Are you very careful who does the hair? Do they wash their hands? Do they take all those precautions? The utensils that use on her hair, do they wash it? Do they sterilize it? Just basic hygiene stuff. If you are doing all that and your baby is still having boils, then we need to check, is there any problem with the immune system? Is it that she's not able to fight those particular bacteria? Those are the kind of things that we need to know about your baby. Okay, I guess I'm almost done now. Okay, any remedy for a sudden frequent urination in child? So sudden frequent urination in child most likely could be a child who has what we call urinary tract infection. So if your child has urinary tract infection, then you need to see a doctor. They need to treat. If the baby doesn't have urinary tract infection, because you say it's sudden, I'm thinking it's urinary tract, because some children also pass urine a lot. So for some children who has diabetes, either mellitus or insipidus, they can do that. But whichever way, you will need to see us. We will need to test the urine. We need to know what is wrong, and then we will treat whichever one is the cause. All right. Final. Johnny is saying, what can I use to remove mucus in baby's nose? Just use your normal handkerchief or towel, face towel, clean it out. What you can say, just remove it. Don't try to suck the nose. Don't try to blow the nose. Just leave it alone. If you think the mucus is not coming out, get saline drop. That's normal saline in a little bottle. You can drop it into the baby's nose. It will soften the mucus, and the mucus will flow out, and you can clean it. That's all. That's all you need to do. No big deal. All right. Albiano G is saying, can a 4-year-old use shampoo to wash the hair? Yes, but use the baby shampoo. Use the age-appropriate shampoo. There's shampoo for adults. There's shampoo for children. Check when you go to the markets. They always write it on it. Make sure you use age-appropriate shampoo. You can use the baby shampoo. It's be fine. Oluwatoyin say, can K-leg be corrected in child? It's on calcium, vitamin D. It depends on the cause of the K-leg. So some K-legs are what we call physiological. Like it's even normal. Like in some family, they tend to have bow legs and all that. But if it's a very severe K-leg, then it means that there's something wrong. Maybe there's rickets. Maybe that's why your physio tell you to be giving calcium. But I don't know whether your physio has done the blood test. So we don't just tell people to go and be using calcium, vitamin D. We need to do the test. So if you see a pediatrician, we'll do blood tests. We know the calcium level. We know all those levels before we say you should go and be using this, using that. What if it's not one of those ones? There are some condition that is surgery. So I would say see your doctor if you are really worried enough about that K-leg. You think it's more than just normal. Then and there's not like in their family people tend to have K-leg. Then you have to see a pediatrician. Let them do the normal test, and then they will do the advice to appropriate. Finally, I answered the last question on Atp Live Monday. Okay, so thank you so much for everyone who have joined me. Thank you, Amarachi, for really helping me with the Atp Live question on the watch party. This was an experiment. We want to see whether we can actually go live on YouTube, on Facebook, and on Instagram simultaneously, and we're able to do it. So what that means is that from now on, Mondays and Fridays, you can watch Atp Live on Facebook, on YouTube, and on Instagram simultaneously. And also, we are now going to be having ATP question of the day again. ATP question of the day is going to be available every day. I'm going to be answering one question a day, and you're going to watch it on YouTube, on Instagram, and on Facebook as well. So watch out for that. It's going to roll out from 1st of September. And finally, for the first time, mom, your course is ready. So you're going to start having your course, and that will be available from, I think we just need to put everything together this week, and then you can start having the course from the second week of September. And there's going to be a WhatsApp group for those who signed up for the course only, where you're going to have me in your group as well. Then we can always continue our conversation there. So thank you so much, everyone, for watching. Thank you, Amara. Thank you. Somebody else is asking question. Please post your question on the Facebook group. You need to tell me the weight of your baby. The best weight before I can say it's normal or abnormal. All right, but I think you can post it on the Facebook group. Somebody will answer. Thank you so much, everyone, and have a wonderful evening. Bye.